School gym, and this is the Maple Run Unified School District Board of Directors meeting that I'm calling to order at 6 o'clock. First, we're going to do an agenda review. Is there anything that needs to be added or subtracted to this agenda? Okay, hearing nothing, I'd like to have a motion to approve the agenda.
So moved.
So
Was that you, Grant?
Second.
Okay. Alan Grant, is there a second? I got a second. All right, we need to do a roll vote. Peter?
Here? No.
No, are you?
Yes.
Jack?
Yes.
Nina?
yes.
Alicia?
Yes.
Katie?
Yes.
Joanna?
Yes.
Susan?
Yes.
Grant?
Yes.
Al? Thank you, motion carries. Next item on the agenda is the Pledge of Allegiance to the flag. Please join me. Where is the flag? Up. Oh. Pledge allegiance
To
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Next item on the agenda is the visitor section, public comment. So this is an opportunity for the community members to address issues of concern about policy, budget, or administrative matters, or to share ideas about how we can work together to improve our schools. We value input and respect divergent views. We ask you limit your remarks to time constraints prescribed by the chair and refrain from airing grievances with individual members of the school community, including respecting the privacy of the students and parents. Those attending remotely may type their full name in the comment section if they wish to speak. During the meeting, the comment sections may be disabled. So, thank you for that. Anybody present wish to speak? Okay, come forward, state your name, please. 2 minutes on each topic.
Hello, my name is Dr. Jennifer Williamson. First, I just want to thank you guys for voting for the liaison program. Last meeting, I'm just so excited and really appreciative of all of your hard work, so thank you. Second of all, by day, I'm a physician, and so I'm looking at the numbers constantly and trying to decide how I'm going to advise my patients to deal with the ongoing pandemic. So I wanted to read some of those statistics to you because they're really, really important. So today, as of today, in Franklin County, our total vaccination rate is 76%. It is not the 86% that you hear when the governor talks about the state that is relying on numbers in Chittenden County, in Lamoille County, and other counties that are not here. 12 and under, 0 across the state. 0% of kids 12 and under are vaccinated. 12 to 15 in Franklin County, 57%. 16 to 17-year-olds, 68%. And the only populations that are actually above 80% in Franklin County are those above 60 years of age. Some interesting data came out today about Israel, and the reason why this is important is because Israel's numbers look a lot like ours. So Israel, their vaccination rate today is one of the highest in the world, 75% of the eligible population. They vaccinated 50% of their eligible population by March 2021, and exactly 6 months later, they're getting a case surge. And the reason why that's as important is because with vaccinations, we often see that there will be a series of vaccinations, that there will be one, there will be one a month later, and then about 6 months later, you'll get a third. And what we're seeing is that's true today with the COVID vaccine. So as we're getting a Delta surge, we're also seeing that we're hitting that 6-month mark after 50% of the Israeli population has been vaccinated, and they're all getting Delta. Though waning immunity is only for mild and moderate diseases, the vaccine still works to keep people out of hospitals and out of morgues. Last Thursday, they reported that the rate of serious disease, hospitalizations among 60-plus-year-olds that were unvaccinated was 9 times higher So I asked today, I know I've got just a few seconds, 6 key prevention strategies: consistent and correct use of masks, requiring kids to hold it, above their nose where it's most effective, physical distancing whenever possible, hand hygiene and respiratory etiquette, cleaning and ventilation is very, very important, contact tracing, isolation and quarantine, and surveillance testing. Testing, especially those people in the schools who are not vaccinated, like teachers. Maximizing vaccine rates and eligible staff and students, less focus on barriers, it hasn't been effective. Move activities outside if possible, go to more remote days, and being careful with after-school activities. Thank you so much.
One quick question for clarification. The stats that you gave at the beginning, when you say vaccinated, do you mean fully vaccinated or received only 1 shot?
For the Israeli numbers?
No, the local.
For the local numbers, I don't know that it clarified on the DOH website. It just said that it was 12 to 15 was 57%.
Okay, thank you. Next, anyone else wish to speak? Yes, come on up, state your name.
Hi, I'm Angie Sturm. I just wanted to voice support for the safety measures that are in place as school has begun, and thank all of the administration who has anything to do with the decision making about keeping kids safe, and for everyone in our community, and also for the most vulnerable. And I just wanted you to know that there's a lot of support in our community for making decisions that are safety oriented, and I just wanted to thank you.
Thank you. Next, anyone in the audience? Anybody type their name in the comment section?
Not yet.
Anyone else wish to speak?
We do, I'm sorry.
Okay.
Ryer Erickson was first.
Ryer?
Yeah, thanks. Can you hear me?
Ken?
Okay. First of all, I just wanted to say I got to participate in Walking Wednesdays today at St. Albans City School. I was a parent who helped shepherd the bus from Barlow Street School all the way down to City School, and it was a great experience. It was really fun. Those are the kinds of things that I think really make small town America great, like the idea that you can walk from one side of the city to the other with I think we had 41 kids with us, and it was just a great experience. And I just want to really give kudos to City School and the people who put that together, because it was a great experience. I also want to thank the board for their vote at the last non-special session meeting to approve a police liaison. I think that was a great sign of compromise. I think the fact that it had 8 votes for was a great sign that people were willing to compromise, to come at it from all angles, and to really approve a plan that most people, I think, could get behind. So thank you for that. I did want to correct one part of that, because I think there was a lot of talk about this being a democracy and majority rules. And, the truth is we don't live in a democracy. We live in a constitutional republic. The majority doesn't rule here. We elect leaders to make the right decisions for us, to research things and make the right decisions for us. And so I just think that's important going forward, to remember that your job as leaders of the school, as leaders of our community, is to make the right decisions, to do the research and make the right decisions. I also wanted to talk a little bit about Fairfield School and their vote. I think it's really sad that, for a school that has 15%, almost 15% of our students, they only receive 2 half votes. That's not that's not even really representative of the students they have, and it's certainly not equitable considering that they're so far from us, from the rest of the schools. And I really like to see I really like to see you as a board try to look at how you can give Fairfield equitable representation, because I think it's important. And lastly, I see once again that anti-racism and implicit bias training is still on a future agenda item. And I really, it's been like that for months. And while I appreciate that, I think what we saw last meeting with the amount of people, or with the comments made in chat, telling people to leave, telling people to get out, it's really important to look at that, because I've experienced those comments from people. I've experienced comments like that from board members. And I think it's important for you all to really think about the way that implicit bias and anti-racism training can help you all make the school system, Maple Run School District, a more welcoming place for all parents, all students, all educators, all community members. So just in the future, I just love it for you guys to maybe look at that, maybe take that a little bit more seriously, try to move that up as an actionable item at some point in the near future. Thank you guys all for your time tonight, and thank you.
Thank you. Anyone else in the chat?
We have one more, Jeffrey Nelson.
Jeffrey Nelson.
Good evening, Maple Run community. Hello.
Hi. You can go ahead and speak.
Can you hear me? Anybody?
Yeah,
we
yes,
can.
we
Can you hear me?
Yes.
Okay, thank you. Recently, we lost a great educator, historian, sociologist, and author of James Lowen. And it occurs to me that it's just as important to unlearn things as it is to learn them. No matter how many degrees or years of teaching experience that I'm addressing, which I assume dozens, hundreds of years, my wish is for all of us to take account on a somewhat regular basis of also what should be unlearned. Dr. Lowen authored the landmark book, Lies My Teacher Told Me, Everything Your American History Textbook Got Wrong. Another Lowen work was Lies Across America, in which he told all about the falsified history on markers and monuments. Most of us have had the experience, I hope, here, at least one educator who taught us to pursue knowledge beyond the course or the degree, to question our leaders and institutions because they could bear it. And I dare say for thousands or millions of people, Dr. Lowen was that educator. And by no means are gaps in education limited to history. Just to name a few examples off the top of my head, what affects to all of us, what we think we know about ostriches and lemmings and wolves is wrong by the common understanding. And the information age has changed many things. We don't have to rely on Pliny the Elder, who told us a rumor about one of those animals 2,000 years ago. And nowadays, it's cool. It's a very in thing to check sources. And I approve of that trend. We have Snopes and we have Wikipedia. And if not, we have the good old fashioned library as well. And it's hard to tell what the next fallacy will be that comes up. And thinking critically, sometimes it's messy, but it's very necessary. And the idea that it's only one discipline or that it affects someone in their school day, but not someone in their life, I think is unfortunate. And so in this age of extraordinary knowledge where we have millions of people's lives work at our fingertips, there's no excuse to not also unlearn certain things that we've learned. And so even if it makes us feel uncomfortable and puts us in an uncomfortable place to admit that we're wrong about something or that these revered educators were wrong about something, it's important to do. It's important to find your blind spots. And I appreciate that. Thank you. Thank you.
Thank you. Anyone else listed in the chat to speak? Last opportunity to participate in the visitor section. Okay, I'm going to close the visitor section of the agenda. We're going to move on to the consent agenda. And before we accept the consent agenda, I want to pull the minutes from August 18th, 2021 and August 23rd, 2021 and table them and place an agenda topic on the next meeting called minutes discussion. We received a request from a board member to talk about our minute taking process. And so therefore we can't talk about it unless it's on a warned agenda according to Robert's rules, modified Robert's rules that we follow. So I'm making that request so that we can have that discussion at the next meeting. So I took out August 18th and August 23rd minutes. So the consent agenda now includes only the media packet and staff changes. Any objections to accepting the consent agenda? Thank you. All right, we're up to old business retreat update. You guys have received in your calendars a Wednesday and a Monday.
We actually solidified on the 22nd.
22nd for sure,
Yeah.
okay. And I'm going to let you give us an update.
So I think, one of the things that with our current COVID conditions and having a retreat, last time we were up at Hardak, which had a lot of air and a lot of space and place outside. So if the board is still willing, I would recommend that that's where we have our retreat again. We haven't checked on the availability, but it gives us a lot of open air. And as we all know, being outside is one of the best. We will be dealing with some weight issues, but between Aaron and myself, we'll work on that. I see a lot of nods in agreement, so I'm just going to take that as, I can't see online. I don't know if Nina or Alicia or Al have any thoughts on that, but I'm just trying to keep us in a place where we can spread out and have the best open air, literally, to meet. Thanks.
I'm good for that. I'm good for that. Thank you.
Problem I have is I'm currently under quarantine again. I went off last Thursday, back on Monday.
Okay.
So it's crazy up here at the moment.
Okay. Well,
So
I'll work with you and we'll see what we can do.
okay, thanks. Appreciate it.
Yep.
Okay, well, we can see if we can get them on remotely.
Right, that's what I was thinking. And that's why I said I'd work with Al to try to get him on remotely. Yep. All right, so I haven't checked with Hardak yet, but is that good, Joan?
Mike, can you make sure that we have the right volume? I handed them the mic.
Hello? Test, 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 test. He's working on it. Test. Hello?
Oh.
Does that work better?
Turn it on.
Mike, thank you for being here, by the way. Mike's taking care of all the techie needs. So, that works.
Test, test, test. Not very loud. I have another one though.
Okay, so I'll talk into it a little louder. Hopefully that's helping. Oh, there it goes. So I'll check in with Hardak tomorrow or the next day to see if we can get that space. And if it doesn't work, we'll find another comparable space where we have some good air. I'm thinking about that.
You can carry on, you're on the agenda for next week.
Thank you, Madam Chair. School opening and COVID update. So we've had a great opening to school. Since we last spoke, we had finished our in-service and started school on the 25th. I want to say that the energy back in the buildings has brought a level of excitement that I haven't seen for a couple of years. So it's just so invigorating. I know that my colleagues have said that to me on the leadership team that are here, and I've experienced it myself from being out in the buildings. It's just incredible. It just reminds me the start of school every year and seeing the students come back, whether they're 3-year-olds coming into pre-K for the first time or seniors who are ready to say, I'm done with my 13, 14 years at Maple Run. They always invigorate me because they're ready to see all their friends. This year, there is a lot more of that than there was in previous years. I've got to say that the students have been really great with everything that we've had to do with COVID. I also want to say that I was able to attend 2 open houses, one at BFA and one here at City School. Lots of positive energy with parents and kids, and it was just phenomenal to see everyone ready to come back to school. I didn't get a chance to get up to Fairfield. I know there were some open houses that happened there. They were done classroom-based, and the same was done at Town School. And those connections are being made. I really want to thank our staff. They're the ones who do the work. Our staff in the classrooms, in the halls. Now it's getting really loud. Tell me when I get too loud, okay? And they're supporting the kids and the families. And that is so, so important in their work. They've really made it a welcoming place, and there's been a lot of reconnecting. I've seen a lot of positive and heard and first witnessed. I can show you a photo from yesterday up at Fairfield of just the kids and the joy to be back together. So, you know, we've heard a lot about mental health needs of our kids and COVID and how we balance that, and that's forefront. I know I can say this for our whole team in our thinking, and that's really helping them be a great place. And we've had a really smooth start. Well, for some of our students, this is coming back to a place they haven't been in a full school for almost 18 months. So for some of that, that's somewhat anxiety producing, and I know our staff have supported students that have gone through that. So they're doing a great job. The other thing I wanted to talk about is give you a COVID update. And I want to remind the board, and I want to thank you for our special meeting we had last Monday where you authorized me to make all the recommendations, to follow the recommendations of the Department of Health, AOE, and other agencies to provide COVID protections for our schools. I have witnessed myself, and I hear from my colleagues, we have a high fidelity rate of our staff and our students following those guidelines. I think there's been some very rare instances where we've had kids that haven't been wearing their mask correctly, and we're taking the approach of education. We're not, as I said to you back in that special meeting, we're not taking the approach of discipline. I know of a colleague that had a 2-hour education session with a student, but they got resolved. And and that was with a high schooler that was, needed to talk it out. So I encourage our staff to keep doing that. I encourage our principals to keep encouraging everyone to do that, and to work with the kids. I think that's really, really, really important, and that's why we're here to educate. And the other thing that I've been saying, and I've said it a couple times to some of my colleagues on the leadership team, is that we are all public servants. And it can be frustrating for us at times when we thought we got in this for education reasons, and that drove us. But our public needs us to be taking safety first right now. And so this is the public's work, and this is the work we'll do as a team. So, and I want to thank the leadership team for doing that. They have spent many hours, and I'm going to talk about some of the hours that some of our principals spent this past weekend. So currently, as of right now, we have 12 cases across all our schools in Maple Grove. There are a couple other districts that I know in Vermont that are close to our numbers. And we have approximately 170 students right now that are in quarantine situations. So it would be a lot higher if it weren't for the vaccinations of our families. I see some of my colleagues nodding their head. Parents have been great about attesting to vaccinations and letting us know that their students are there. According to the recommendations, if a student isn't showing symptoms and they've been vaccinated, or any individual that's been vaccinated, they're not showing symptoms, they can be back in the classroom. And that's really brought quite a few kids in school learning. We started receiving reports on Friday and more on Saturday of students that had tested positive for COVID. And I really want to thank our principals and directors. They worked over the weekend. And they decided not to involve our nurses because they were already still worn out from last year, and took on the contact tracing with support from me. As the recommendations come out, we can call the Department of Health if we don't understand what COVID tracing is, but beyond that, that's all ours. As of yesterday, I hadn't heard of it's CIC, and I'm not sure what that stands for, but it's the contact tracing folks that have been contracted by the state of Vermont. We have not had them contact us telling us of the other case. That may have changed today. So with all that said, we do have, I think it's 3 classrooms right now that are out across the whole classrooms out. And a lot of that happens in our younger student classrooms with kids under the age of 12. From the recommendations that we're following for the contact tracing. And once again, thanks to the principals and the directors. They did a lot of work this weekend, yesterday, and Monday. Monday, up pretty late at night. So thank you, team, for pulling together on that. And as I spoke earlier, we'd have more students out if it weren't for vaccinations. So since this weekend, and I've been thinking about it before this weekend, but since this weekend and seeing the cases, I started thinking about mandatory vaccinations for all staff. I've received comments from that from parents. And as of right now, I'm in the place where I'm going to mandate vaccines for the staff. I want to take the temperature of the board and where the board's at. I don't need you to take an action. I'd just like to have some discussion around that. But before we get into that, I want to tell you, and this has been done in 3 or 4 districts so far, and I know this discussion is happening in other districts tonight and later on this week and next week with boards. Some superintendents are seeking the determination of the boards, and some of us have the authority that you granted me and we're doing it. And I heard from you at that special meeting that you expected this was my work to do. So I'm working in that manner. The 3 or 4 districts that have already put this in place, they have procedures that we can use, and they've given me all those procedures about how they're doing it and timelines to allow staff to become vaccinated. There would be 2 exemptions. One exemption would be for health reasons, a second one would be for religious reasons. There would be a process for either of those to be able to, under my judgment, whether we accept those exemptions or not. And those have been figured out. I talked with the school's attorney today, and those processes are set down in procedures, so we'll be pulling those together. I feel it's the time for the Maple Run, if you're a Maple Run staff member, to be vaccinated. And I've become very convinced of that in the past 5 days. And I know I have the support of my teammates. And I have talked with the association, and they're in support of it as well. So that's where we are at that point, and I would open that up to discussion. If you ask me a lot of bits and pieces of the procedures and timelines, that's what we're working on tomorrow and Friday before we put them all out to everyone and inform them on this. I can't answer all those little pieces because I don't have them.
So let's have a little discussion about it. Looks like Susan wants to talk.
Well,
we're just going to have to pass this because people get it.
so know that I was going to ask you, because I don't want to get it wrong. I think the hospital now has mandatory vaccinations with procedures in place for people that choose not to get vaccinated. Yes?
That's correct, but the procedure is to get tested on a weekly basis.
Right,
so.
and if they don't get tested and turn those results in, then it results in disciplinary, what do they call it? Corrective action.
It's not the same as what Bill's is
Right.
talking about.
So I certainly support, at the very least, that type of procedure.
I think it's a courageous move, and I think it's the correct one, and I would support it.
If you choose to comment.
Yeah.
You don't have to. You don't have to.
No, I know.
You don't. And I'm not looking for everyone to comment. I'm doing a temperature check of you.
Sure. I mean, personally, I'm in support of it. My question would be, have you thought about how you would handle people? I mean, are you prepared to put people on corrective action or to let people go if they refuse to become vaccinated?
Yes, I am. My mask falls down. Thank you. That right there.
Totally supportive of that process. Totally supportive of mandatory vaccination.
And anything that increases the vaccination rate in schools, I will support.
Okay. Alicia or Al or Nina, do you wish to comment?
We're commenting on if we support the vaccination. Sorry, I couldn't hear the last couple of people there. I think it was Jack and Grant. Is that correct? Is that what you're looking for, Bill?
Everybody seems to be in support so far. If you wish to comment related to supporting mandatory vaccination for.
Okay. Yeah, I'm in support of it, but I just a question for Bill. What would be the corrective action? I heard Joanne ask that.
Yes.
Well, asked her. She said, she didn't ask that. Sorry, she said support it. But what's the corrective action you would do, Bill? I guess is my question.
Well, like all corrective action, whether it's students or staff, we have a progressive discipline policy in the way we do our work. and I would start just like we have with the students around education. And it probably would be a conversation with myself or Casey Provost, our HR coordinator, about, where are they at, why are they at this place? Do they understand, what the data is, and try to do it that way. I always believe you start everything with a conversation. You don't go right to corrective action. If I'm asked that direct question, I'm going to answer it directly and saying, I will get there. It's not going to be my first tool out of the box.
Does HIPAA play any part of this for the, for privacy, if people are getting it or not getting it?
So it was ruled on by this past July when some corporations started to mandate vaccination, that this is the right of organization, and you all received, I think, through Vermont School Boards Association, a statement about our insurance supporting this, that supports the mandated vaccinations, and that it is a better place to go for insurance protections for the organization.
Yeah, but again, does it address any of the HIPAA laws, though? I guess is my question. Do we need to check on that?
I have talked with our attorney. We're fine. We're fine. That way we can ask for proof of vaccination.
Thank you.
Any other comments? Al, Alicia, any comments?
Yeah, here's the situation. I'm sitting here quarantined in my room for the next 10 days again. I got off 10 days on Thursday. Sunday, apparently one of the non-vaccinated staff people tested positive, or at least came under a positive thing, which doesn't make any difference if you are false positive or not. We go through another 10 days of quarantine. So the issue is, for those who do not want to get vaccinated, do you say, as of X day, you get vaccinated or terminate? I think in the health field, I think that's gotta come, and it will come. Whether or not we can do that with the teachers, I don't know.
Thanks, Al. Anyone else?
I feel like I should say something too. With the change and everyone recognizing that educators are also essential workers, it makes sense that we're shifting to this as the healthcare organizations are as well.
Great. Okay, and you did mention that the association was on board, right?
Yes, I talked with the association yesterday.
And I think there's a member of the association listening. It is going to give you a thumbs up if he's in agreement. Thank you. Okay.
There's two association members there.
Where's the other? Oh, sorry. Thank you. Anything else related to school opening and COVID update?
I'm all good. I'm all good.
Okay. Thank you, everyone, for your comments. I think you got a.
Yeah, I got what I needed.
I think you got what you needed, right. And item B is student enrollment report. We have one in our packet. Bill's going to talk us through it.
Yes, you should see in your packet, and I'm sorry I don't have slides up here for folks to see here. There's a first day enrollment report, and as I said in the cover memo, I really want you to take this with understanding there's a little bit of a grain of salt here, because our first day is never where we settle, probably by our 10th day. And so I actually thought about putting more data in here, and I stopped myself because I said, I want to make sure it's valid. But I also, as we talked in our retreat, the board said, let's have some reports. And before I get to the calendars, I said in my memo, I want to give you little pieces of data so I'm not, one of the things I got accused of in the past in serving boards was I would stack it with data. And it was just too much for anyone to look at. So I'm trying to get it right. And there's sometimes you'll say that's not enough or that's too much. Just let me know, because I want to know where the will of the board is with that. So I tried to do is give you an update. I know I've told you some of this verbally, but we're seeing an uptick in student enrollment, which is great for Maple Run. And I wanted you to have an idea between the different schools, and I wanted you to see some longitudinal data. I do want to note, and I know I put it everywhere, This year's the first day enrollment, where we take enrollment and it's used for the average day. There's 3 or 4 different ways to count kids in Vermont. And what you'll hear is the average daily membership, or ADM, and that's based off the 30th day enrollment. So this graph for every other year is the 30th day. This year is what we started school with. And I will tell you, in my experience, I used to do a lot of data work with school districts, they never equate. There's trends, but they're never the same. So they fluctuate. So I really want to see that. But what I wanted the board to say from our retreat agenda and talking about more work was really kind of see the makeup of the district just by population. We'll get you more on class sizes and what our average class sizes look like, how many students are free and reduced lunch, and what some of those are, and different categories for students that you know of, from the way in which we look at student characteristics. But the good news is just about everywhere we're either flat, and I know that Kevin has said to you, and I'm on the first page, that as the overall enrollment, we're either staying flat in Maple Run for years, and that's what we see again this year. We saw a downward tick last year, and we believe that's due to COVID, because we had a lot of homeschool kids. So that's coming back, which is great. And then on the next page, you'll see the enrollments for each school. The 2 schools that are up is, which I told you last time verbally in our last meeting, is we're seeing an increase at BFA and at SATEC. We're seeing pretty flat here at, even though it looks a little down, but it's the way the graph is scaled. We're seeing a change of like 12 students here in city schools, and I think we're 2 up at Fairfield. So pretty flat overall for those 2 schools, but good increases at Town and BFA. I then gave you a pie chart just of the distribution by ethnicity and race. I think we have to know our data about race and ethnicity to be able to talk about equity. So I wanted to make sure that this was shown. It's shown across Maple Run. One of the things I have to be really careful about, and I have to check this again, but is that you can't backwards calculate it to a number 10 or less. So if there's a percentage here and you know the total number of students, would you stay at a number above 10? That's Vermont State's procedures for keeping students protected. So anytime you're showing student data, you can't show a number less, 10 or less. And you can't calculate into a number 10 or less. And I gave you some of the examples in my memo. And then I just gave you a table of the data that you have there. So, and gave you some historical enrollment by grades. So, I felt that that was enough for this first trial of a report to all of you, and then I'm opening it up to questions. I thought I would bring more, but just to be really honest and transparent, I was hoping to have time between Monday and now, and with the work we need to do with COVID, I had to put my focus there. So, hand this back to you.
Anyone have any questions for Bill on the data you received? Joanna?
I do. What is ENR, Bill? I don't know what ENR is.
ENR, so
Early childhood programs, but I don't know.
yeah, ENR is right now we have them enrolled. They're enrolled, but they're not placed right now. That's a piece that comes out of our student information system, where we're placing them into different schools that we don't have placed yet. That sometimes happens with a pre-K, especially on the first day.
So there's currently 64 students.
We had 64 at that time. That's changed since then. They've now been placed. Part of the problem with pre-K started the next day, so they weren't all placed in the right schools.
I understand.
So our pre-K 8s, the numbers will probably change because of that, because they weren't in the right schools.
Thank you.
Yeah. And that's the fluctuation that's
Sure.
happening.
Absolutely.
Do I need the mic to talk, or?
Go ahead.
Do I need the mic?
Unless you can speak loud.
I can speak loud.
Go ahead.
You're
not doing it yet, though.
The increase in enrollment for BFA, do you feel that's above and beyond the margin of error between day 1 and day 30? And if it is was there something that we did intentionally to increase enrollment that we intend to build on? Or is that just kind of a random chance thing?
So I haven't had a chance to talk with my colleagues about this. Right now I've talked quite a bit about that enrollment and where is it coming from. But we don't have anything, there's nothing we can go to like causality or correlation on that. Okay. We know that we had a smaller graduating class and a larger freshman class come in. Yeah. We haven't done the subtraction to see the difference and then see what the change is. And that's frankly where we're at right now. And you asked something else, Grant, that I didn't answer.
I was wondering if the margin.
The margin. I don't know what the margin of error is because I could go calculate that, but I haven't gone back and compared first, especially in Maple Run first day. Yeah. For my experience in history, because I'm used to this is a report that happens every first September meeting at every board. That's what I'm used to doing. And it's just like this. It's just an enrollment report. Yeah. And we had, usually that number can change as much as 2% maybe in a school between the 30th day and the first day, plus or minus. Okay. That's high. Usually it depends on the demographics and mobility of the students, and that's different in different towns. I haven't done a study here, and Jones talked to me about this, and I don't remember the numbers, and I'm not going to call on it right now. But I know that in Winooski Valley, because I did this for years, for a child making a move from one school to another, from September to September, 28% of the students were doing that. Now that's Central Vermont. I don't know about Franklin County. Okay. So I just want to let you know that. And well, I hope, I know we'll do better to get you that type of information so you can have, what's the context for this data? And that's what I hear you saying, Bill, I can see the data, but give me some context behind it.
Well, it sounds like there's that, at least a 40 or 50 student increase, even if the 70 student increase isn't 100% real. Right. There's at least a substantial increase.
There's a substantial increase, and there's a substantial increase that's impacting our teachers. I will say at the high school, the classes are much larger than they used to be. Right. Okay. And we're working on that. We're working on ways to reduce that and what we can do this year. We don't have any answers for you right now, so.
I'm looking at it as a good problem. Are you guys?
Oh, I'm looking at it as a good problem too.
Good.
Yeah, I'm not looking at it as a bad problem. I'm looking at it as a good problem. Yeah.
Thank you. I think in the past years, there used to be a lot of fluctuation between city school and town school, and back to city school and back to town school.
Yes, that's
years. Anything else?
Al.
Oh, Al.
How do our Georgia numbers look?
So we haven't disaggregated that on this right now. And I didn't ask for our tuition students versus our resident students. But if you'd like that out, we can bring that when we do a full demographics. As I said in my memo, we do in October.
Thank you.
Yep.
Anyone else have questions related to school and student enrollment report? Okay, I'm going to move on to other business. We have the warrants. I need a motion to approve the warrants.
The warrant be approved, acknowledging that signing of the approval of the minutes by the board acts as individual signing of their signatures act as blah, blah, blah.
Okay, so acknowledging that the passage of this motion will act as individual board members participating remotely, authorization of their signature on these warrants. We have Al made that motion. Is there a second? Thanks, Joanna. Any discussion? Okay, we need to take a vote on the motion. And Peter, we have a motion on the floor to approve the warrants.
Approved.
Jack, we'll be right back. Nina.
Yes, approved.
Alicia.
Yes.
Katie.
Yes.
Joanna.
Yes.
Susan.
Yes.
Grant.
Yes.
Al.
Yes.
Nilda's a yes. This passes without Jack necessary. So we can move on to the superintendent's report, and that's going back to you, Mr. Superintendent.
Yeah, I have way too much talking tonight. We got to change that. All right, so here, there are a couple things I'd like to ask the board if we would like to do a couple of things. One, the first thing I'd like to note is we talked about this back in June or July about the attendance of the leadership team members. I just wanted to note most of them are here. Some of them have family conflicts. And if you watch my opening remarks at convocation, you'll know that my highest value is family and yourself is first. So if you need to go be a coach, someone's being a coach tonight, someone's organizing a different sporting event, they're not being a coach, or something else that's with your family, and we have representation from the building, that's how we're doing that. So if you say, hey, I'm not seeing someone tonight, it's because if they come to me and say, I got a family thing, and there's a way we've got the building covered, so I want to make sure we have building representation here.
I'm all for that. I don't see a need for people to come to a meeting.
Yeah.
I think that if it's your school and you're going to be presenting and people might have questions or there might be visitors that, specifically want to speak to you, fantastic. Otherwise, if we're not supposed to address administration beyond you, do you know what I'm saying?
I do.
Then I don't see the need for.
Good, thank you. And we're, when we talk more at our next retreat about some of the structures and the reporting, we may talk about how we used to have a principal voices piece on that and where we want that on the agenda.
So let's just get a check here how the rest of the board feels about this. Is everybody comfortable with that plan?
Mm-hmm.
Okay, people remote, are y'all comfortable with the plan that Bill laid out?
Yes.
Perfect, thank you.
Thank you. The second thing at the next meeting, I beg the chair to think about, I know that you and I developed the agendas together, but that John present an update on where we are with the envisioning plan. And I think that we're going to start getting into some community engagement with that. And we were just updated today from the Agency of Education, and I think the board needs an update. You asked for one, and that would be our next report. And John would lead that because he's leading that work now. He's taking that on from me.
Sounds great.
And along with, I'm sure he's going to be asking some of our colleagues to help. The last thing I'd like to do, one more thing. These are short ones, and the last one I'm going to do is an SRO update. The state's statute changed this year to change the procurement process. We don't need you to change your policy, but we will be changing our procedures. And since the board is part of the procedures, when we go over, right now it's currently $30,000 that you have to approve purchases. That dollar figure has changed. And at the next meeting, I'd like Martha to talk about how those procedures and where those dollar figures and how it's affecting the board. And that's happened from two areas, state statute and federal procurement pieces. And I'd like her to talk about that. Perfect. Lastly, I just want to, I'm going to do this each meeting between now and, so there's really this meeting, the next meeting, then we're at the October 1st, but I thought I should keep you updated where we are with the SRO process. Current member, the leadership team and I, some of the members of the leadership team and I have started to meet this week. I will tell you that got delayed a little bit as I gave you the COVID update, so I was hoping to have more tonight than we did, but I think we made the right choice in working on the COVID and putting that aside for a little bit. Hopefully by the end of the week, our work right now is we're trying to take the work the SROs did and say, okay, what's a district liaison work and what is a work for an MRUSD staff member. And really, we have to get really concrete with this. And as I said in the last meeting, we don't have any time logs to know exactly what the SROs were doing, but that's what we're looking at right now. Like I said, we're hoping to have that complete by the end of this week. We are already seeing from doing that work that we're going to have to hire some employee or employees. I don't know the FTE yet. So we're going to have to look into that. And they'll need to have skills of mental health, de-escalation skills, and be able to have really positive relationships with kids and how to cultivate those. So it's not going to be an ESP level or even a behavior interventionist level type of person. This is going to be someone with some skills, and there'll be some cost to it. So I just want to let you know we don't have that figured out yet. I'm just letting you know as a board. Currently, the city and school district, we've begun discussions about moving from an SRO to a district liaison. The city's really waiting for us as a leadership team to complete our work, because they're like, so what do you want for a district liaison? And we have to get into that concrete discussion of what the tasks are. So we're doing that. We're in that work. I was in a meeting today with them. The city asked, the chief of police asked me to let you know, and the city manager that their hiring environment is the same as the schools in much of Vermont. They're having a hard time keeping staff on. They want to make sure the district liaison is the right person. We're in total agreement about that. That is shared across. They're worried about that they're losing staff. They're from the police department. So we're still in discussions. I plan to report a lot more at the next meeting. It's been cordial discussions, and we're moving forward. So.
Not to point out the obvious, but I'm just wondering, since there's already some communities that have, like you were able to use the Essex Westford policy or proposal, I should say. Do they also have they weeded out some of that work?
Not much more than what I did.
Okay, just
so,
wondering.
And it's different. I mean, we know we have the Essex template. I know I could go to Montpelier and what they've done, but we have to go to a finer level than that.
Sure.
And so, you have a job description. This is general for all. It's not just SRO. You have a general description of what, there's a bullet. Okay, what does that bullet really mean? But let's talk about what you're doing.
Yeah.
And that always happens for any of us that have been in HR positions. It's just what we need to do.
Okay.
So that's taking a little bit. One of the things I did talk about, we're going to need to hire some folks for the district, either one or more employees. I will tell you, I am concerned of meeting the October deadline and hiring our own folks to keep our safety. It's not a good hiring environment. I reported last meeting on where we are. We're not fully staffed. We're still in that same place. That's not changing. That doesn't mean I'm not trying to meet the deadline. I just want to tell you where I see issues so that you're up to speed. So we're going to keep going forward. I don't know if you heard, Joanne, I'm sure you're up to speed on this, but just so you know, as I talked about, this person's going to have a lot of mental health experience. Currently, and I heard this today, I didn't hear it directly from NCSS, so my number might be off, but they have approximately 70 open positions in NCSS. That's the market we're going to be in. So just want to let you know that. That's really all I have. I'm optimistic about moving forward and where we're going to get to, and following the direction of the board from last meeting.
Thank you. And maybe just another way to look at it could possibly be to just be providing more training to the current staff that we have. So possibly
that's going to be part of it.
Some people, the hiring is terrible.
Okay, thank you. Next item on the agenda is board announcements. I have one, maybe two. So we've all been getting some emails that are addressed to the whole board. I want you guys to know that whether it says I copied Bill or not, I am forwarding them to Bill, so we don't all have to forward them to Bill, just so, I'm just trying to keep the email traffic down. That's the first thing I do, just so you're aware, and even if it says he got it. Okay, so that's just a housekeeping thing. And the other thing I was asked to bring up again is, do we want to continue having these face-to-face meetings, or do we want to consider going to Zoom again? Just putting it out there. It came up.
I'm going to say, I feel like, so one of my, I don't know who it was that asked me recently, are you wearing masks into the store? And as a healthcare worker, I'm wearing masks into the store because I feel like I need to set a good example. And I believe in masks. I mean, it's what saved me last year. And I think if we're expecting teachers and students to be in the building, I think that I also want to be in the building. Right. So, and I thought everyone deserted me today because I went to the central office and I was the only one there. But
Can I comment on that?
Just so you know, Susan, Nilda and I talked, and the board room is so small.
Yeah,
and I have to thank my colleagues. They all said, hey, we'll find a big space in our school.
yeah, no, I remember that conversation 2 weeks ago.
Yeah.
And I'm cool with that. Coming here, I feel like we jump through a lot of hoops to make this all work for everyone. And that's kind of the downside of it. You're not able to display slides that maybe you could have used.
I could have. I didn't plan.
I understand. I'm not advocating one way or another. I just want the pleasure of the board. But as we get more and more people like splitting, it's going to be more difficult, right? Because you can't see everyone's face when everybody's on Zoom, you're all on Zoom, right? And you've got the Hollywood Square model, and you can tell everybody's present. That's the thing. I don't know if this is going to get better or worse. I appreciate the fact that if we want our kids in the school, we should be in the schools too. I get that.
Yeah,
I
yeah.
totally get that. I go to work, I have to wear a mask every day too, right?
And
So-
I just want to be clear. I feel like I want to be here. That doesn't mean that everyone needs to be here.
No,
you know,
and,
I think
and
that
everybody has the option each and every time to not
Yeah.
be present and be on Zoom. I don't know if anybody remotely has any comments to make. Okay. I mean, I'm just throwing it out. Go ahead.
Yeah, sorry. So I talked to Nilda a little bit about this today. One of my kiddos wasn't feeling good, and so it just seemed like the better choice to not come in person. And I guess are we just going to leave it up to that discretion of individual members to make that best decision for themselves? Are we expecting that people are going to share their reason why, or trusting that? I guess I just want to know.
I mean, I don't think anybody needs to share any reason why they do anything like that, for sure. Unless you want to, email me privately. But I guess we just, like we said last time, we have to reserve the possibility that we may have to make a last-minute decision because of whatever all is happening in the community that we're in.
Yeah, I think people make their own personal decisions, and we just continue to follow the guidance.
There you go. Okay, I just felt compelled to bring it up again.
Yeah,
Grant.
thank you.
I might add that, if you're attending in person, especially if we're now asking, teachers to be vaccinated, to attend in person, be vaccinated, be healthy, have those around you be healthy, might be some good guidelines.
Yep.
And to not attend in person is at your own discretion for whatever reason you may choose.
Gotcha. Great.
Thank
I
you,
would suggest, I don't know.
No, I mean, common sense needs to prevail in all of this, right?
If we're going to support it happening district-wide, then we need to model that too. I agree with that.
So now I'll start coughing. Make it all work. All right. Anyone else have any other board announcements they'd like to make?
Do we?
Yes,
I
Greg.
have more of a question about the agenda for next time and the way that relates to SROs. If the only thing holding up SROs is the liaison is the hiring process, I feel like we need to have a path forward there, because that seems to be a likely outcome. So, and next meeting is our last meeting before that October 1st deadline we set.
Yeah.
So, we need to have a kind of blue sky, right? We get everything in place, plan, but I think there also needs to be a backup plan that addresses specifically hiring.
Yeah,
Okay.
it's here, but I'm not saying in this meeting.
But so that we can take action if we need to at that board meeting.
Yeah, that's a good point.
Okay.
And if we have to do a special meeting somewhere along the way, we learned last week that we can throw that together pretty quickly, and that would definitely be a Zoom thing.
Sure.
Just because it's.
And I won't try to surprise the board. I'm going to try to be, that's why I want to do these updates.
Yeah.
So you know what's going on. You're not, the board isn't surprised. I don't like it when I have to surprise the board. That doesn't usually work well.
And the other thing is the VSBA is offering an equity-minded leadership course. And as a chair, I have to take so many hours of training. So I think I'm going to sign up for this. But I think it's open to all school board members.
Yep, I saw it
And
too.
if you sign up, whatever it costs, I think the district picks it up.
We'll take care of it. Yeah, we can find it.
So anyway, it's called equity-minded leadership. So I offer that out.
Is that the one that's during the day, like at 1 o'clock?
Well, it said you have to merge it into your day. I haven't actually registered for it yet. But
There was one that was 1 o'clock, and I actually responded back to them, just saying that, some people might be interested in that, but wouldn't be able to go during the day.
I think there was something at 5:30 too.
And they were they sent out a new one,
Yeah.
saying that they could offer it at night as well.
Yeah. Anyway, throwing that out there. Any more board announcements? Okay, agenda items for future meetings. Obviously, we have our list here of implicit bias training, anti-racism, recovery update, 5-year plan, IT study. We're going to have something come up about how many dollars before we have board approval. the envisioning plan, SRO updates, COVID updates, all of that. Anything else that we need to get on here?
I think you'd mentioned at the beginning something about the minutes and
Yeah.
public comments.
Yep. So I think the item I called it, what, minutes discussion. But we can pronounce that a little bit better.
Okay, thank you.
But that's the discussion. Thank you. My list. All right, we have no need for executive session. Any more business to come before the board? Hearing none, we are adjourned.